Hi, everyone. Welcome to our presentation on understanding hospice and palliative care. This is presented by New England Hospice. My name is Jessica Peterson. I'm a social worker and the volunteer coordinator with New England Hospice. Thank you for joining us today. So, why are we talking about this today? One of the most important reasons is this fact here listed below. 25% of deaths occur at home when really 80% of Americans would prefer to die at home. So it is important to have this knowledge so that we can honor those wishes. There are different types of care. So we have curative care, which focuses on a cure of an illness and prolonging of life. That's what most people receive when they are young and healthy, or they are trying to address an illness. Palliative care is the focus on comfort and quality of life that may be provided with other treatments. So other treatments are allowed during palliative care. Hospice care. This focuses on comfort and quality of life when a cure is not possible with specialized care and services. So what is hospice care? Hospice care provides support for those in the last phase of life-limiting illnesses, recognizes the dying as part of a normal process of the living. Hospice care affirms life and neither hastens nor postpones death. And hospice care focuses on the quality of life for individuals and their family caregivers. Hospice care provides pain management, symptom control, psychosocial support, and spiritual care to patients and their families when a cure is not possible. The nation's hospices serve more than 1.5 million people every year and their family caregivers too. Hospice is the concept of caring for the terminally ill, which dates back to the 1960s. It revolves around the concept of caring for, as we just stated earlier, an individual's physical, emotional, social, and spiritual needs. It puts a focus on improving the quality of life and not a cure. So we focus on quality and not quantity. By recognizing dying as a natural part of life, hospice will support the patient and family in maintaining control at the end of life with their choices and through the bereavement period. Many people only consider hospice care in the final days of life, but hospice is ideally suited to care for patients and family caregivers for the final months of a person's life. So, what is palliative care? Palliative care can brings the same interdisciplinary team as a hospice care to people earlier in the course of a serious illness, and it can be provided along with other treatments they still may be receiving from their doctor. Treatment that enhances comfort and improves the quality of an individual's life who is facing an illness, but not they don't qualify yet for hospice care, so they're not at that very end stage. Also, the expected outcome is relief and distressing of symptoms, easing pain, or enhancing quality of life. Hospices are the largest providers of palliative care services and can help answer questions about what might be the most appropriate for a person. Many hospitals also have palliative care teams available to provide services. Here are the differences. It is important to know that hospice and palliative care are available to people of all ages with any serious or life-limiting illness. The differences between hospice care and palliative care. Palliative care is on the tan on the left. So there is treatment. You can receive palliative care alongside care from the specialists who have been treating your particular illness. And it can be utilized prior to hospice care for those who do not qualify for hospice care at this point in time. On the right side in the white, hospice care, there is no treatment. It provides support and care for those in the last phases of life-limiting illness. For those who are expected to live 6 months or less, the doctor would give this assessment, and it recognizes dying as a part of the normal process of living. So the core aspects of hospice care are the patient and family, the interdisciplinary team, providing a range of services such as interdisciplinary care, case management, pharmaceuticals, durable medical equipment, supplies, providing volunteers, and grief support. Additional services. Hospice offers additional services including hospice residential care in a facility, inpatient hospice care, palliative care, complementary therapies, specialized pediatric teams, caregiver training, and bereavement services. So here are some team members: the patient's personal physician, the hospice physician, or we sometimes call them the medical director, nurses, home health aides, social workers, clergy or other counselors, speech, physical, and occupational therapists, and trained volunteers. Work of the hospice team. So, what the hospice team does, and we did talk about how the hospice team is similar to the palliative care team. So, what the hospice team does specifically is they develop a plan of care, they manage pain and symptoms, they attend to emotional, psychosocial, and spiritual aspects of dying and caregiving. They teach the family how to provide care. The family is the caregiver, advocates for the patient and family, and provides bereavement care and counseling as needed. So, where is hospice provided? Hospice can be provided in the home, so that's the patient's or loved one's home, a nursing facility, which is also considered their home, a assisted living facility, if that's where the patient is living, the hospital, a hospice residence or unit, sometimes called a hospice house, and a correctional setting, homeless shelter, or wherever that person is located. Hospice is and should be provided wherever a person is located. So, who pays? Medicare, Medicaid, insurance, HMOs, private pay, and sometimes a combination of these. Hospice care is fully covered by Medicare and Medicaid and most private insurance plans. So it is important to acknowledge before I go back that hospice is a benefit. So the care provided is a benefit, and usually no one has to pay at all for it. Admission criteria. So how do you know that you qualify for hospice care? These are the general requirements. Life-limiting illness, a prognosis is 6 months or less, or the disease, if the disease takes its normal course. So your doctor has assessed you and stated that they would not be surprised if you died in 6 months or less. You live in a service area, you consent to accept the services of hospice care, and you forego other medical interventions for terminal illness. Signs to look for. So, a couple signs that you could look for that someone may be on the verge of qualifying, or you may just want to get an assessment, would be they suddenly lose a lot of weight unintentionally, they are falling frequently, their doctor thinks they have 6 months or less to live. They are unable to complete their daily activities, such as eating and bathing on their own, and they are not participating in their daily activities, so they're beginning to withdraw. So it is important to remember that bereavement support is available to you and to your family for 13 months or as little or as much as you need. We can provide you with the resources you need as well. So we do provide this services to families and friends and whoever needs the support at this time. So thank you so much. I did just want to end on a quote that I found that a hospice nurse said when she was recently asked, "How can you work in hospice? It must be so sad." She answered, "I love providing highly skilled, compassionate care because I know I make a huge difference in the quality of a person's life. I love that I can use my training as a nurse to bring comfort and dignity to my patients and see the relief on their faces and on the faces of those who care for them. I love that I can offer practical solutions to patients and families and help them find more meaningful moments at the end of life. Hospice is not about dying, but it's about living as fully as possible despite the life limiting illnesses." Again, thank you so much for attending. Please reach out if you have any questions. We are always available. You can reach us on our website, our social media, on Instagram, our Facebook page, YouTube, and you can contact us via email as well. Thank you so much and have a great day.